talk a little bit about the incidence of breast cancer. Why is it an important problem? Breast cancer by far is the commonest cancers that we see in our practice and in the whole of the country. If I were to give you some numbers, about 13% or 13 to 14% of all the cancers that we see are breast cancers. So in India, on an average, about 15 lakh cancers are diagnosed every year, of which 2 lakhs are just breast cancers. And that's the burden we're talking about. 2 lakh women diagnosed with breast cancers every year in our country. And that's a lot of numbers. In fact, when we look at cancer-related deaths, 1 in 10 patients who die of cancer are from breast cancers. So it is a big problem for us. We have a lot of people with breast cancer. A significant amount of death happens because of breast cancer. When we start looking at Karnataka itself, of the 2 lakh breast cancers that get diagnosed, about 14 to 15,000 are in Karnataka, which has got one of the highest incidence of breast cancer in the whole of the country. And what is unfortunate part of it is that the breast cancer incidence is getting younger and younger. So we are seeing them in much younger age groups. There was some data that came out just out of Bangalore that the number of breast cancer diagnosed in Bangalore between the age of 20 and 40 has doubled in the past 5 years. Whether it is better awareness or true incidence is very difficult to tease out. But we've got doubling of the numbers of the younger patients, younger people who are getting breast cancer to the age of 20 to 40 years. It is a big problem. And the only way to reduce the death rate is to screen, to breast cancer screening. And that is why we have this program here. And if you look at some statistics about breast cancer screening, it is miserably low across the country. So there are data that says that only 1.3% of the women across the country undergo breast cancer screening. 1.3%. Fortunately, Karnataka has the highest screening rate at a miserable low of 2.9%. It's not great. In the country, it's the highest. I think we have a long way to go. So these are the numbers we're talking about. Across the country, 1.3% people undergo screening. In Karnataka, it's 2.9%. Okay. Maybe there's a slightly more awareness, but we still have a long way to go. The vast majority of the women get screened because screening is the only way to reduce cancer-related mortality, to reduce the cost of cancer burden both to the government, to the insurance companies, and to the people who are going through it. Because once you're treating them in an advanced case, in an advanced situation, the cost really escalates up quite significantly. And of course, the death rate comes down significantly if you're treating them in an early stage, in the stage 1 and 2, as opposed to stage 3 and 4. So
if you talk about any breast cancer in the family, the one thing that people think about is a fearful treatment. So let me go through, take you all these things that is it really a fearful treatment? No, I can tell you it is not really a fearful treatment. So we can put it into diagnostic and the treatment part. The advancement has happened in such a way that we can identify the breast cancer with a simple crooked biopsy, and advancement is in such a way that we need to look for a lot of molecular markers that definitely will guide us. That is important. And then comes a whole body scans or a MRI. That's what the doctors is going to do, tell about a PET CT scan that will a correct diagnosis and staging is done. So the moment if the staging is done, so we can always tell that multidisciplinary team approach, that is what we do it in our hospital, Apollo Cancer Center in Bangalore. So where every case is discussed in tumor board and make a roadmap for the treatment. The chemotherapy, surgery and radiation is the main stage for the breast cancer. There's a lot of developments has occurred. So if you consider any of this treatment, the fearful for the patient is it I'm going to get curable, and is it the treatment is too toxic. So definitely we have gone through, there is enough evidence to make sure that targeted agents, especially chemotherapy and immunotherapy, has made the effective treatments, outcomes are good with the least side effects. Coming to the surgery itself, so the mutilating surgeries of removal of the whole breast is definitely not required. So what we call it is a breast conserving surgery, minimal invasive surgeries and robotic surgeries, that is what we are looking at. It's not only the outcomes it matters when you are looking at the breast cancer, it is the quality of life. When a patient looks at her own breast in front of the mirror, she won't even identify the surgery is done. That is what we are looking at in terms of robotic surgeries to look for the breast.
ಸಂತೋಷ ಆಗ್ತಾ ಇದೆ ಯಾಕೆಂದರೆ ಈ ಒಂದು ಚೆಕೋಲೇಟ್ ಕ್ಯಾಂಪೇನ್ ಮುಖಾಂತರ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅವೇರ್ನೆಸ್ ಕಾರ್ಯಕ್ರಮನ ಅಪೋಲೋ ಕಡೆಯಿಂದ ಇಷ್ಟು ಒಂದು ದೊಡ್ಡ ಪ್ರತಿಷ್ಠಿತ ಸಂಸ್ಥೆ ಅವರು ಒಂದು ಇನಿಷಿಯೇಟಿವ್ ತಗೊಂಡಿದ್ದಾರೆ. ನಿಜವಾಗ್ಲೂ ತುಂಬ ಸಂತೋಷ ಆಗ್ತಾ ಇದೆ. ಮತ್ತು ಪ್ರತಿ ಹೆಣ್ಣಿಗೂ ಈ ವಿಷಯದ ಬಗ್ಗೆ ಗೊತ್ತಾಗಬೇಕು. ಮತ್ತು ಕರ್ನಾಟಕದಲ್ಲಿ ಬೆಂಗಳೂರಲ್ಲಿ ಕೇಸಸ್ ಜಾಸ್ತಿ ಕೂಡ ಇರೋದರಿಂದ ಈ ಮೆಸೇಜ್ ರೀಚ್ ಆಗಬೇಕು. ಎಲ್ಲರೂ ಹೋಗಿ ಅಂದರೆ ಇವರು ಯಾವ ಕಿಟ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ ಅದರಲ್ಲಿ ಅದನ್ನು ಸ್ಕ್ಯಾನ್ ಮಾಡಿ ಸೆಲ್ಫ್ ಚೆಕಪ್ ಯಾವ ರೀತಿ ಮಾಡೋದು ಅದ್ರ ಬಗ್ಗೆ ಇನ್ಫಾರ್ಮೇಷನ್ ಇದೆ. ಜೊತೆಗೆ ಇವ್ರ ಸೆಂಟರ್ಸಲ್ಲಿ ಹೋಗಿ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಸಿ ಅಂತ ನಾನು ಹೇಳೋಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ಆಮೇಲೆ ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ವರ್ಷಕ್ಕೆ ಒಂದು ಬಾಡಿ ಚೆಕಪ್ ಮಾಡಿಸಲೇಬೇಕು. ಸೊ ನಮ್ಮ ಆರೋಗ್ಯಕ್ಕಿಂತ ಏನೂ ಮುಖ್ಯ ಇಲ್ಲ. ನಮ್ಮ ಆರೋಗ್ಯ ಚೆನ್ನಾಗಿದ್ದಾರೆ. ಯಾಕೆಂದರೆ ಒಂದು ಸಮಾಜ, ಒಂದು ರಾಜ್ಯ, ಒಂದು ರಾಷ್ಟ್ರ ಬೆಳಿಬೇಕು ಅಂದರೆ ಆರೋಗ್ಯ ಬಗ್ಗೆ ಗಮನ ಕೊಡೋದು ಅದು ನಮ್ಮ ಪರ್ಸನಲ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಅಂತ ನಾನು ಹೇಳೋಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ಸೊ ನಾವು ಇನ್ನೂ ನಮ್ಮ ರಾಷ್ಟ್ರ ಬಲಿಷ್ಠ ಆಗಿರಬೇಕು ಅಂತ ಪ್ರತಿಯೊಬ್ಬರು ಅವರ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಚಿಂತನೆ ಮಾಡಬೇಕು ಅಂತ ಹೇಳ್ತೀನಿ.
Hi, I'm Dr. Jayanti Tulsi here. I work as a lead and a department surgeon in the Department of Breast Oncology at Apollo Cancer Center in Bengaluru. Today, the initiative of Check-Olate is an extremely important initiative where we are linking dark chocolate with breast self-examination. Every box of dark chocolate has a small note, has a QR code. If someone scans it, takes you to the site which will show you a video of breast self-examination. For breast self-examination, as the name suggests, is a simple test which a woman can do herself, and this can be one of the very important ways of detecting a lump in the breast which could be cancerous at an early stage. Because breast cancer, though the numbers are increasing, it is a very treatable cancer. If we detect the disease early and treat it timely, we can look at complete cure from the disease. And this is one initiation from Apollo Cancer Center to help women to detect the disease early. As Indians, we all have sweet tooth. Come any festival, it is associated with sweets. And amongst the sweets, one of the better sweet to choose is dark chocolate. Because dark chocolate has a lot of medical help in it. It has some what are called as flavonoids which can have a positive health effect, and one of them could be reducing the risk of cancer and breast cancer. Thank you.